Harvey's parents, Gillian and Stephen, arrived here just before 4 p.m. for that meeting, which is continuing this evening. Now, it was a pre-planned meeting designed to continue discussions with the government about what kind of inquiry should be held into what happened to Harvey. And just to remind people about what happened to Harvey, he was a sufferer of scoliosis and spina bifida. He spent many years on a waiting list for surgery, and he suffered for many years. He finally received that surgery in December of last year, but unfortunately in July of this year his health deteriorated and he passed away at the age of just 9. Now, ever since then, Harvey's parents have been demanding answers as to what happened in Harvey's case and why there were so many delays in his care. They say they just want to make sure that nothing like this ever happens to any other family or any other child like Harvey. But they will no doubt at this meeting also have many questions about something that emerged at the weekend in newspapers, and that is that a whistleblower has come forward and made a protected disclosure to the HSE, alleging that Harvey was deliberately taken off a waiting list for surgery because Children's Health Ireland was mistakenly under the belief that he was a palliative patient and therefore not suitable for surgery. Now, this is something that Harvey's parents say they weren't aware of either at the time or before these reports came out at the weekend, so they'll no doubt have many questions about this today at this meeting as well. And this latest revelations in Harvey's case were also raised in the Dáil today by the Sinn Féin leader Mary Lou MacDonald.
The truth is that Harvey, having been deemed fit for surgery following an assessment made by an outside consultant from Great Ormond Street Hospital on the 17th of May 2024, a decision was then taken just weeks later by CHI to remove him from the list and to describe his future care as palliative. The whistleblower has identified each step of this scandal, which left a small, vulnerable child to suffer and deteriorate.
But I want to make it clear that neither myself, the Tánaiste, nor the Minister for Health had any awareness of this. This is a factual position, and it's not right or proper that in my view, that any other construction should be put on it. As we now know, any protected disclosure is investigated by an independent person.